Today, we're going to talk about a single blood test that, believe it or not, tells a super detailed story about your health. We're not talking about just today, but for the past 3 whole months. It's called the A1C test, and honestly, it's an incredible tool for understanding your body's relationship with sugar. So, you're probably wondering, how does that even work? How can one little blood draw give your doctor this window into your health that spans an entire season? Well, that is the fascinating question we are going to unpack right now. All right, let's start with why this long-term view is so important. The real magic of the A1C test is that it gives you the bigger picture, which is way more powerful than just a single snapshot of your health on any given day. Think about it this way. A daily glucose check, the finger prick test, that tells you your blood sugar in that exact moment. It can swing wildly based on what you just ate or if you just worked out. But the A1C, it smooths out all those daily ups and downs. It gives you the average, the real trend, over a much longer period. Okay, so how in the world does it capture that long-term average? The science is actually pretty cool. Let's break down the biology behind that final number you see on your lab report. It all starts with this super important protein called hemoglobin. You've probably heard of it. It's what makes our blood red, and its main gig is to carry oxygen from your lungs to, well, everywhere else. But it also has this other job it does by accident, and that's what makes the A1C test possible. So here's the main idea. The glucose from the food we eat is just cruising around in our bloodstream. And when there's a lot of that sugar, it gets kind of sticky. It starts latching onto other things it bumps into. And you know what one of its favorite things to stick to is? Yep, hemoglobin. Let's walk through it step by step. First, you eat. Your food gets broken down into glucose, and that goes into your blood. Then, as it's floating around, some of it just permanently gloms onto hemoglobin. This creates what scientists call glycated hemoglobin. So the A1C test, it's really just measuring what percentage of your hemoglobin has that sugary coating. And that brings us to the magic number, 3 months. So why 3 months? It's because that's about how long a red blood cell lives. Once glucose sticks to hemoglobin, it's stuck there for the entire life of that cell. So, by measuring how many of these sugar-coated cells you have, doctors get a really reliable average of your blood sugar levels over that whole 3-month window. Pretty smart, right? Okay, now that we get the science, the next big question is who should be getting this test? Let's get into the practical, real-world advice on this. According to the CDC, routine screening is a good idea for pretty much everyone over the age of 45. But if you're younger, there are definitely some risk factors to keep on your radar. Things like having a family history of type 2 diabetes, being overweight, or dealing with high blood pressure. All of these are signs that getting screened a little earlier could be really beneficial. And beyond just the risk factors, your body might be giving you some direct signals. If you're feeling incredibly thirsty all the time, or you're urinating a lot, losing weight without trying, or just feeling exhausted, these could all prompt a doctor to order an A1C test to figure out what's really going on. So, you've gone and had the test. Now for the most important part. What does that percentage actually mean for your health? Let's decode these results. The results basically fall into 3 buckets. An A1C below 5.7%, that's considered in the normal range. A result between 5.7 and 6.4%, that's a heads up. It signals prediabetes. In an A1C of 6.5% or higher on 2 separate occasions, that typically leads to a diagnosis of diabetes. But, and this is incredibly important, you have to remember these numbers are just a guide. They're not some absolute rule set in stone. Your personal A1C goal can depend on a ton of different factors, so it is absolutely essential to talk about your results with your doctor to understand what they mean for you. So let's dig into the implications here a little more. What does a diagnosis of prediabetes or diabetes actually mean for you, and what happens next? The main reason a high A1C is a concern is because it means you've had consistently high levels of sugar in your blood. Over time, all that extra sugar can damage the delicate lining of your blood vessels and nerves, which can lead to really serious issues with your heart, your kidneys, you name it. And that's exactly why catching it early is so critical. It's also pretty interesting how the test's job changes depending on the condition. For prediabetes and type 2 diabetes, the A1C is used for both the initial diagnosis and for keeping an eye on things long term. But for type 1 diabetes, which is an autoimmune condition, it's not actually used to diagnose it, but it becomes a key tool later on to monitor how well treatment is working. And finally, it's really important to know that this test isn't perfect for everybody. In some situations, like during pregnancy, or for people who have blood disorders like anemia, or even severe kidney or liver disease, the A1C test might not be accurate. In those cases, doctors have other ways to check on blood glucose. At the end of the day, your A1C is just a number. It's not a grade, and it's definitely not a judgment. It's a piece of information, a chapter in your health story. So, the most powerful question it leaves us with is this: how are you going to use this information to write an even healthier next chapter?